Hi everyone, Dr. Chiam here from Ensoul Medical. We are on a 5-part series on rejuvenation of the face, and in the earlier videos we talked about the 4 components of facial aging. We talked about volume, we talked about elasticity, we talked about skin quality and texture, and as well as pigmentation. So in the last video we talked a little bit more about how volume affects facial aging and how treatments like fillers can help play an important role in the rejuvenation of the face. Today we're going to talk about the next component of facial aging, and that is elasticity, and what treatments there are available on the market to help you achieve your facial rejuvenation goals. Okay, so elasticity of the face can be broadly divided into 2 main areas: the deep part of the face as well as superficial part of the face. By deep structures, I'm referring to structures in the face such as the ligaments of the face, which hold the face up a little bit like a net, and also the connective tissue layers of the face. The best known of these is called the superficial musculoaponeurotic system, SMAS, or SMAS for short. This is an important structure in the face that surgeon friends like to target when they are doing surgical facelifts. So there are some non-invasive options, of course, for patients who do not wish to go under the knife, to be able to target these deeper structures, and we're going to talk a bit about some of these treatments. So how do we target the deep structures in the skin, such as the SMAS as well as the ligaments? A very popular treatment these days is known as HIFU. It's pretty good for targeting these structures non-surgically. HIFU stands for High Intensity Focused Ultrasound. HIFU works by concentrating ultrasonic waves into various depths of the skin. When we concentrate ultrasonic waves at a particular depth of the face, we create a small island of controlled thermal injury at the particular depth, and in the process of healing, the skin produces more collagen, so you get collagen stimulation. You also get collagen remodeling, which means the collagen fibers are more organized, and you also get a little bit of contraction of the skin, so that gives you a lifting and tightening effect. There are patients who would tell you that HIFU may be a little bit uncomfortable. So at Ensoul Medical, we have 2 different options of HIFU for our patients, depending on your lifestyle as well as your comfort levels. We have the traditional HIFU, which is a once in 9 to 12 month sort of treatment, and we also have this other HIFU machine called the Sigma Lift. The Sigma Lift is a completely painless procedure. It can be done as a lunchtime procedure with no downtime, but this requires a few more treatments compared to the traditional HIFU. HIFU is generally a very low downtime procedure. The traditional HIFU, after the procedure, some patients may experience a little bit of achiness. It's a little bit like a muscle ache after you have done a workout. This achiness can last you for about a week or up to about 10 days. There's generally no scar or no redness on the skin, but some patients may feel a little bit swollen over the areas that have been treated. But generally, the level of swelling is usually not visible to others. For the Sigma Lift, is pretty much a no downtime procedure. It is a quick 30 to 40 minute procedure, and patients can return to normal activity almost immediately. So HIFU will help improve the elasticity of the ligaments as well as the SMAS layer of the face by firstly stimulating more collagen, secondly stimulating the remodeling of the collagen in these layers, as well as stimulating contraction of these ligaments as well as SMAS layer, such that you produce a tightening effect and improve the deep elasticity of the face. So at Ensoul Medical, we have what we call an anti-aging laser program, which helps our patients improve their superficial elasticity of the skin. This is a laser program that is a combination of erbium as well as long pulse Nd:YAG lasers. With the anti-aging laser program, we are able to target deeply into the dermis of the skin, stimulating more collagen and elastin production over a period of 3 to 4 weeks. So even after the one treatment, most patients can feel a tightening and lifting effect of the skin, but it's the subsequent collagen production that happens 3 to 4 weeks later that is the most important and most stable. And generally, we do recommend that our patients who want to see improvements in skin elasticity to do this treatment about once a month. So the anti-aging laser is a no downtime procedure. Basically, all you probably get is a little bit of mild redness of the skin, which settles within about an hour or two, and there is no swelling and no scars or scabbing associated with the laser. So I hope you learn a little bit more about the elasticity of the skin, and in the next few videos we are going to talk a little bit more about pigmentation. We're also going to talk a little bit more about skin texture and quality. So stay tuned. Thank you for watching.